Knee arthritis can be a painful and debilitating condition, but the good news? There are evidence-based treatments that can help you manage it effectively. Let's dive into the science of knee arthritis and the best ways to treat it. Believe it or not, one of the best ways to treat knee arthritis is through movement. Strengthening the muscles around the knee, especially the quadriceps, can reduce the stress on the joint and improve function. I know it might seem counterintuitive, you're in pain, so why would you want to move more? But trust me on this one. Studies show that low-impact exercises like swimming, cycling and walking can help manage arthritis pain without worsening the condition. These activities are gentle on your joints while still providing that crucial strengthening and range of motion improvement. Now, I know everyone's at a different fitness level. If you're just starting out, even a short walk around the block can make a difference. The key is consistency. Find an activity you enjoy. That's important for sticking with it, and gradually increase the intensity and duration over time. And don't forget about physical therapy. A trained physical therapist can create a personalized exercise plan tailored to your specific needs and limitations. They can teach you the proper form to avoid injury and ensure you're targeting the right muscles. Remember, movement is medicine, especially when it comes to knee arthritis. Excess weight adds pressure to your knees, about 4 pounds of pressure for every pound of weight gained. That's a lot of extra stress on those joints. By losing even a small amount of weight, you can significantly reduce knee pain and slow down the progression of arthritis. Research published in Arthritis Care and Research found that losing just 10% of body weight can result in a 50% improvement in knee pain. That's huge. It shows that even small changes can have a big impact. Now, I'm not talking about crash diets or extreme measures. It's about making sustainable lifestyle changes. Focus on a balanced diet rich in fruits, vegetables and lean protein, and incorporate regular physical activity into your routine. Remember those low-impact exercises we talked about? They're not just good for your joints, they're good for weight management too. Even small changes like swapping sugary drinks for water or taking the stairs instead of the elevator can add up over time. It's about making healthy choices a part of your daily life. Non-steroidal anti-inflammatory drugs, or NSAIDs, are commonly prescribed to reduce pain and inflammation in the knee joint. These include over-the-counter options like ibuprofen and naproxen, as well as prescription medications, but it's important to use these under the guidance of a doctor, as long-term use can have side effects like stomach irritation and increased blood pressure. Your doctor can help you weigh the benefits and risks and determine the appropriate dosage and duration for your specific situation. If over-the-counter NSAIDs aren't providing sufficient relief, your doctor might consider prescription strength options or other pain relievers. The key is open communication with your healthcare provider. Let them know how you're feeling and any concerns you have. Remember, medication is just one tool in the arthritis management toolbox. It's often most effective when combined with other treatments like exercise and weight management. It's about finding the right combination that works best for you and your individual needs. Chapter 4. In some cases, your doctor may recommend injections to directly target the inflammation and pain in your knee joint. These can provide significant relief and improve your mobility. Corticosteroid injections are a common option. These powerful anti-inflammatories are injected directly into the knee joint, quickly reducing inflammation and providing relief that can last for weeks or even months. Another option is hyaluronic acid injections. Hyaluronic acid is a naturally occurring substance in your joints that acts as a lubricant and shock absorber. With osteoarthritis, the hyaluronic acid in your knee can break down, leading to increased friction and pain. Hyaluronic acid injections work by replenishing the depleted levels of this vital substance, providing cushioning and lubrication to the joint. This can help reduce pain and improve mobility. It's important to note that the effectiveness of injections can vary from person to person, and they may not be suitable for everyone. Your doctor can help determine if injections are right for you based on your individual needs and medical history. Chapter 5. Knee braces and supports. Stabilizing your joints. Knee braces and supports can be incredibly helpful for managing knee arthritis pain, especially during activities that put stress on your joints. They work by providing external support and stability to the knee, reducing the load on the joint and alleviating pain. There are different types of braces available, each designed for specific purposes. For example, some braces provide compression, which can help reduce swelling and inflammation. Others offer more rigid support, limiting movement and protecting the joint during high-impact activities. Your doctor or a physical therapist can help you determine the best type of brace for your needs. It's important to note that while braces can be very effective, they're not a substitute for other treatments like exercise and weight management. They're most beneficial when used as part of a comprehensive treatment plan. Think of braces as a tool to help you stay active and manage your pain, allowing you to participate in the activities you enjoy. Chapter 6. Surgery, when conservative treatments aren't enough. While we always try to exhaust all conservative treatment options first, there are times when surgery becomes necessary to address severe knee arthritis and improve your quality of life. If you're experiencing persistent pain that's not responding to other treatments, or if your mobility is significantly limited, surgery might be an option to consider. Arthroscopy is a minimally invasive procedure that involves inserting a small camera and instruments into the knee joint to repair damaged cartilage, remove loose fragments, or address other issues. It's often used in earlier stages of arthritis. In more advanced cases, a total knee replacement might be recommended. This involves replacing the damaged surfaces of the knee joint with artificial components, providing significant pain relief and restoring mobility. Knee replacement surgeries are highly effective, with over 90% of patients reporting a significant reduction in pain and improvement in mobility post-surgery. However, it's important to discuss the risks and benefits with your surgeon to determine if it's the right option for you. Remember, surgery is a big decision, and it's essential to be fully informed and prepared for the recovery process. Chapter 7. Supplements and Alternative Therapies, exploring additional options. While not a primary treatment for knee arthritis, some people find relief through supplements like glucosamine and chondroitin. These supplements are thought to support joint health by providing building blocks for cartilage. However, the research on their effectiveness is mixed, and they may not work for everyone. It's crucial to talk to your doctor before starting any new supplements, as they can interact with certain medications. In addition to supplements, some people find relief from alternative therapies like acupuncture and massage. Acupuncture involves inserting thin needles into specific points on the body to stimulate energy flow and reduce pain. Massage therapy can help relax muscles, improve circulation, and alleviate pain. While more research is needed on these therapies, they can be a complementary approach to traditional treatments. Remember, it's essential to approach alternative therapies with caution and consult with your doctor to ensure they're safe and appropriate for you. Take control of your knee. Health. Remember, knee arthritis doesn't have to control your life. With the right treatments, you can manage your symptoms and stay active. Whether it's through exercise, weight management, or medical treatments, there's an evidence-based solution out there for you. Stay active, stay informed. Thanks for watching. If you found this video helpful, give it a thumbs up and don't forget to subscribe for more evidence-based health tips every week. Let me know in the comments what treatment has helped your knee pain the most.